I want to have a quick conversation before we fully jump into our program here today and invite Steve Love, the President and CEO of the Dallas-Fort Worth Hospital Council, to come on up to the stage. Let's give him a round of applause. Steve? Where do you want to sit, sir?
I'll sit here. Is that okay?
Well,
okay, well, here.
First I'm going to ask you where, and then I'm going to tell you where. Why don't you sit there?
Right.
You've got that microphone on this side here. This way you can
I hope it's ready. Yeah, right.
So I don't usually give the keys to the car over to moderate these panels. I just really like to make sure that they're authentic and that some interesting questions get asked with a smile and all of that good stuff. But Steve Love is somebody that I trust and respect and admire, and so he's going to be moderating this lunchtime panel with Senator Nathan Johnson, with Christian Puff from Hall Render, and with former Commissioner of HHSC, Charles Smith. So he's going to be moderating this session, but before we get into that, I wanted to ask you a little bit about you, sir, and make sure that people in the room know kind of all the stuff you're doing behind the scenes. Let me ask you, admittedly, a little bit of a softball, but everybody I talk to likes you, and they respect you. Why is that?
I don't know. I can give you a list of people that don't like me, but I think at the Hospital Council, and it's really a tribute to our member hospitals. We have hospitals that compete, no question. They each want market share from the other. We also have 90 associate members, business and industry, prominent law firms, accounting firms, consulting firms. But we have a spirit of being Switzerland. You can come to us and voice your opinion. We stress education and collaboration, and then we try to network in the community. And I think that's why people really feel at ease with us.
You'll recall you and I met, I think, 4.5 years ago, and we were talking about hosting our Austin conference, and you've been in each one of those and brought members of your team, like Kristen and others. And one of the first things you said was, that's great, and we want to support you because we need more of this stuff. We also want you to do this in Dallas. And I was like, okay, can we walk before we run? Can we let's do Austin. But all that to say, this event today is 4 years in the making, and you have been the most important person in driving and helping make this happen. So thank you for your partnership and your support.
Thank you.
I appreciate it.
Yeah.
Let's just give Steve a round of applause because he deserves it. So you're going to be asking questions in a minute, but I want to ask you a couple questions about the work that you're doing. A central question mark in Texas healthcare is what will happen with DSRIP funding within this waiver, and then maybe after. There are a lot of opportunities in that conversation if consensus exists. You've been doing a lot of work to try to facilitate and foster some answers. Why don't you bring us up to speed on the work you've been doing on this DSRIP question?
Yeah, I think when we get the expert panel members up here, we're gonna see that the 1115 waiver DSRIP funding is going away. So at the Hospital Council, we tried to be proactive. In fact, we engaged one of our panelists, former Commissioner Charles Smith, and we put together a plan to try to bring $1 billion into Texas, especially for mental health. And it would not cost the state any additional new funds, nothing out of the general revenue. We put that plan together. We went to the legislature. We had bipartisan support. Unfortunately, it did die in committee, but we took that blueprint, and Charles and I met with Commissioner Courtney Phillips. She was very receptive, and we said, at least here's a blueprint to get a portion of the funding restored in mental health on DSRIP funding. We really need to address this. The next legislative session is going to be critical because we're facing a fiscal cliff with this DSRIP funding going away.
Yeah. And what was the source of the opposition? Was it confusion? Was it pure political? Why did this not move forward a little more? A little better?
I think getting people to understand it, and I think people did, but unfortunately, we had it as an amendment on a bill, and that particular bill died in committee, and so our amendment died with it.
So I asked somebody this question at dinner last night, and she artfully dodged it. I'm hoping you won't. When Medicaid was first passed in 1965, the last state in the union to adopt the Medicaid program was Arizona. It did that in 1982, or 17 years later. The Affordable Care Act was passed in 2010. 17 years later would be 2027. Would you take the over or the under on 2027 and Texas expanding Medicaid?
You know, I really think we're going to do it before 2027, and I hope we do it next session.
Yeah, good. Well, I'm going to let you. I'm going to let you invite folks up to the stage and kick this off. I appreciate you doing this. Give me 2 minutes on the clock when you're done to get folks out of here, and I'll turn it over to you. So,
great.
Steve, go
okay.
ahead.
Thanks. So, panel members, if you'll come on up. Glad to have you. And when they come up, I'll quickly introduce them, but their bios in your program. So you'll see that we have a very esteemed panel. With me up here, I'll lower the overall average IQ, but first we have Senator Nathan Johnson, we have Kristen Puff from Hall-Renda, and we have Charles Smith. And I think many of you know Charles is the former executive commissioner for HHSC. And with that in mind, I'm going to go kind of randomly, but we want to keep this as open as we can. And then we are going to allow the audience to ask questions. But what I'm going to do is start with Senator Johnson and allow each of the panelists to take 2 to 3 minutes to kind of have an opening statement. I'm going to ask a couple of questions, and then we're going to turn it open to you. So, Senator Johnson.
Thank you, Steve, and thank you, DJ, for inviting me to be part of this. It was a surprise to me when he invited me to be part of it in the first place, because of everyone in the building, I know the least about this industry. But it is my job to be able to collect and incorporate, and more importantly, put into effect through political mechanisms all the great work that you all are doing. We have tremendous expertise, innovation, and resources in the room, but we're in a political environment where we're treading water, and it looks intractable. And so at dinner last night, the question comes up, is anyone optimistic about this? And I am, and the optimism might seem to be misplaced, but I don't think so. And I'm going to ask for your help in a second on this. But consider an issue where there was apparently an intractable political environment, a history of cutting where we should be investing, over and over again, and it seems hopeless. Education. And last session, my freshman year, we passed dramatic education reform and education finance reform at a level unprecedented in half a century without an order from the Supreme Court for the first time ever. Now, what did we do the previous 3 sessions? We cut funding for education. And suddenly we invested an additional $6 billion into education. How did that happen? What happened was we had an election where people lost their jobs, or almost lost their jobs, not because of the party they were in, but because of the position they took on education. When it became an emergency, it became an epiphany. Leadership woke up this session and thought, I know, we should invest money in education. That's what our state needs. Now, it was almost as if this was a new concept. But it's not a new concept. It's been a problem for half a century, and it's particularly the past decade. And to everyone's credit, across the spectrum, it was a bipartisan effort, and we did some great work on the subject of education. Here we are with healthcare. Similarly, we have a history of doing the wrong thing. Similarly, it seems intractable and like it won't go anywhere, and it takes a naive freshman to even introduce a bill to expand Medicaid. But there's power in not knowing what you're doing. Kelly. There's power in having faith in the people around you and looking around and saying, this is the moment. I don't care what it looked like last year. This year, people are awake. And there's another thing I've got in my back pocket, which is all of you and all of our business friends out there, because Texas politics tends to move where business wants it to. And when business got behind education, it got serious. Well, chambers of commerce throughout North Texas and throughout the state of Texas are really, really interested in what we're about to do. So when we talk a little later, we are going to be talking about Medicaid expansion because it is the largest, it's not the only thing we're worried about, but it is the largest single thing. We're going to be talking about that. But I also want to talk to you about how we can talk to it because it is imperative that we move this forward. It's the moral imperative it's always been, and people are going to recognize it's also the fiscal responsible imperative also. And so we want to talk about how we can get people on board with us. And I'll look to you for help for that.
Charles.
Well, it's hard to follow Senator Johnson, but I'll give it a shot. I remember when I had still have a lot of friends in the legislature who are legislators on the House and Senate side, and I remember one of the conversations that one of them said to me after the governor Abbott appointed me as executive commissioner. He said, "Well, you know, all the time that you work with the governor when he was attorney general and everything, we thought he liked you." And so in the panel this morning, Stephanie Muth, our Medicaid director, said that she felt that her tenure should have been counted in dog years, her longevity. And I disagree with her on that. I think the executive commissioner should be in that role also added. But I will like to say this, and Senator Johnson just mentioned this and talked about a crisis. And I think that's one of the things that is extremely important for us is that oftentimes we say and we see Texans band together when there is a crisis. And sometimes that crisis is real, sometimes it's manufactured, and sometimes it's perceived. But we talk about Texans coming together and figuring out things and making things better. And for those of us, and I'm saying us now this is my 4th year into the healthcare arena, I've joined you, that crisis has been there and that dilemma in healthcare has been there for many years. And one of the things that I saw as the executive commissioner was how do we get people to move beyond some of the partisan rhetoric that is there and misinformation to where we can begin to have a serious dialogue about what the future of healthcare needs to be, how we're going to deal with those who are indigent, and how that impacts our greater system and how it impacts their trajectory on life, because that's really what it's all about. There's no doubt that when I came into the position, is and was and will remain a strong conservative. But what I will say about that is that doesn't mean that you can't understand how decisions impact people. And you have to understand that there is a system here at play that if you will reach out and help people, we want them to be self-sufficient, we want them to be self-directive, we want to have a strong workforce, and then you have to invest in that because we can avoid cost by having a healthcare system that works for more people on the front end that will help drive down costs in criminal justice, child welfare, and so we approach it from a system approach. I think there is an opportunity for us to move forward.
Kristen.
I was not prepared to talk about criminal justice or welfare or education, but I can do that too, I guess. I mean, might not be intelligently so, but I can do that. I have been on several sides of the healthcare arena for the past nearly 14 years. I've worked for a large payer, national payer system. What used to be the largest Medicare Advantage system in the, payer in the country. And then I went to what used to be the largest PBM, pharmacy benefits management company in the industry. And then I went to a physician-owned health plan where I had to work with this guy, where I both built and sold, I told them before that, thank God, a Medicaid plan. So I'm with whoever said I thought Governor Abbott liked you because Texas Medicaid is is important, absolutely, but it's difficult. It's difficult to navigate that arena. And I'm in private practice now with Hall Render. So you talked about the real or the perceived perception of a catastrophe, and the fact of the matter is we do have a healthcare catastrophe here. And how do we get people to understand that it's real? Because sometimes, right now, I think especially, we do have a lot of folks that believe that it is kind of made up. Our system's fine. It's working. Or look at the ACA, it's not working. Or move to England and pay 60% in taxes and have no utilization management whatsoever. And, the fact of the matter is we are the only country like us that takes healthcare like we do, or treats healthcare like we do, and it has become less of insurance and more of just a payment method. In terms of insurance, when you buy a house, you don't get to call and say, my paint's chipping in my bedroom, so can you come in and paint my bedroom? You don't get to call your insurance carrier and say that. That would not be what would be considered an insurable event. And so we've kind of taken the whole idea of insurance and what is traditionally what is an insurable event, and we have turned it into something that's different and really a payment mechanism for healthcare. But the fact of the matter is there's a crisis and we need to address it.
Thanks. So, Senator, do a few questions here. Report came out yesterday, 5 million Texans have no insurance. We're the highest in the nation. It's an increase from what we've had before. For the last 10 years, we've heard some people for Medicaid expansion, some against it. We've heard, it's going to cost too much. So let me just be blunt and ask you the question. Can Texas afford Medicaid expansion?
To sound like a furniture salesman, we can't afford not to. That's the question. Can we afford not to? And it opens up what I was saying earlier about how we talk about these things. Can we possibly afford this? So instead of telling people, yeah, I think we can afford this and we have a moral obligation to support these people, what if you said, I brought my notes with me, and did you know that today, Thursday, the state of Texas is losing $2.6 million in revenue? Not gross domestic product, state revenue. Did you know that Dallas County is losing, and all the other counties in the state is losing $2.2 million in revenue on Thursday? On Thursday, by the end of the next biennium, we will lose $30.7 billion in gross domestic product. We'll lose $1.9 billion in state tax revenue, $1.6 in local revenue. That's $3.5 billion, and it's going to cost $1.5 billion to expand it if the state has to pay. So I think we can afford it. In fact, when we had a little revenue work group in the Senate to figure out how to pay for the wonderful things we did in education, because we do like to pay for things, even though I'm a Democrat, we do like to pay for things. I'm a fiscally conservative. I'm a fiscally conservative Democrat.
You're just saying that because I'm in red.
And that's it.
It's a power color.
When we had our work group to figure out how to pay for things, we were allowed to submit even the most outlandish ideas for where we could get revenue for the state, and I submitted Medicaid expansion as a revenue source. And you'd have thought it was the funniest thing in the world, but I'm serious. We will make money off of Medicaid, and we will have healthier, happier, more productive people. Now, most of you probably know how all this stuff works, but these numbers come from a conservative economist, a go-to guy for Republican administrations, who knows a great deal about Medicaid. He's working with states throughout the nation. Of course, there's 33 to choose from. Texas is just not there yet. These aren't numbers I came up with, or as Ray Perry would say, this is just math, folks. And when we finish the economic talk, we can wind it up with, and we helped people in the process.
Right.
Can I add on? I Sure. know, but I think you were asked earlier about whether this is going to happen in Texas over under 2027. Is that okay? If we look, Beto took Tarrant County in this last election. And whether you like it or not, I'm looking at you. I'm telling you, I'm on both sides. Beto took Tarrant County. That says a lot to me about what's happening politically in Texas. And Texans are ready for change, be it Republican, Democrat, what have you. They're ready for change, and I think healthcare is a big driver of that. So I believe that is the first time a Democrat senator or candidate for federal Senate, right?
U.S. Senate.
U.S. Senate, thank you. Took Tarrant County and all of the other major counties in Texas as well. So.
And it doesn't need to be partisan. A lot of my Republican friends are fully in favor of Medicaid expansion. I'd like to talk about it as a conservative thing to do. We would be, was it 34th? We're not ahead of the curve here.
Right.
Certainly fiscally
And I think
conservative.
ultimately, when we talk coverage expansion, it's what's best for the patient. Hopefully, it should be a bipartisan. We're trying to do what's best for the patient. I agree. So, Charles, let me ask you this. In your previous role as commissioner, and we appreciate your efforts because you had a lot of forces you had to deal with, but I think you did a really yeoman's job in negotiating and putting in place the Medicaid 1115 waiver that we have. I really meant it when I think we're facing a fiscal cliff, especially as we look at DSRIP. So we have an important renewal that's going to be coming up. And CMS has made some structural changes to the waiver. In fact, they've made some, what I consider shock waves to what's coming up. What advice would you give the state as we approach renewing the 1115 waiver?
That's a tough, loaded question. Let me first say it from this perspective, and you asked the senator about the 5 million Texans who are uninsured, and that number continues to grow. I think it's now 17.7%, and it continues to grow. And as the uninsured number in the state grows and the wage issue occurs, then the federal government doesn't really give the state more money. The state becomes poorer. And so our federal medical assistant program, FMAP, goes up. That's really not a good thing for Texas, for us to have poorer people who then are going to be more people eligible for these services that we have that are available, whether that's Medicaid, SNAP, TANF, you can go down the alphabet list. And so when you talk about a fiscal cliff, what I tried to do, getting in and immersing myself in this and talking to a lot of the thought leaders and the presidents and CEOs of the hospitals, the safety net, the teaching hospitals, the private for-profit, the not-for-profits, is to bring people together and understand what the issues were and try to galvanize that to drive forward the best waiver renewal negotiation that we could. And when you look at it from the standpoint of a cliff, DSRIP, I would say, is a drop-off and not the cliff, just from a technicality perspective. Because DSRIP is wrapped up within the supplemental payment programs within Texas. And as I've tried to get people to understand, there is anywhere from $10 to $12 billion annually right now that is available for that supplemental payment program. And we use 3.1 million of it, 3.1 billion for DSRIP. There's another 3.1 billion that we were using for uncompensated care. And then you roll out some of the other programs, QUIP, NAPE, and the others. And so that totals this supplemental payment, but that's outside of the core Medicaid program. And so it's now a public relationship with LPPS and other IGT that comes in to draw down those supplemental payment programs. The cliff is under the direction of the administration, and it started by the Obama administration, and I'm not going to be partisan about this from either side. It's just the facts. There was a decision by CMS that would remove the without waiver cost in future years, and starting in 2022, I believe. And the current administration, the Trump administration, I tried to, for a year and a half, to get them to move away from that aspect, because I know that Texas did not expand Medicaid. And if we weren't going to be having a conversation about Medicaid expansion and what that looked like, then it became imperative to me that I needed to preserve the supplemental payment program in order for us to continue to operate and prop up the safety net in the way that we currently fund healthcare in the state. And so with that without waiver cost going away, not only does DSRIP go away in our current waiver and will not be there in the future, but that was never intended to be longstanding anyway. DSRIP was it was to bring in, because of the ACA, to allow everyone to build the infrastructure because of these new people who would be signing up and be eligible for Medicaid. Put clinics where places where you don't have them and all this other thing. And so, but with DSRIP going away, the bigger cliff is the supplemental payment system program that deals with uncompensated care and DSRIP and everything else will not be there come the next waiver. And that is very quick. We will have one more legislative cycle before Texas will be fully into the throes of the next waiver. And if there aren't some significant changes that are going to be made in how healthcare is funded and what healthcare looks like in this system, then the next waiver, there is going to be a catastrophic event is going to occur when you have $10 to $12 billion annually that comes out of the healthcare system in Texas.
Yeah, and the thing, I think we have to and see if you agree or not. People say, well, the next legislative session, the federal government's fiscal year starts October 1st. Correct. So it could get here sooner than we think.
And the HHSC will be required to submit their waiver before, likely before the legislative session ends.
Exactly.
And because it's just the timing, they will require them to do that anywhere from 12 to 18 months beforehand. And so the wait and see is going to be extremely problematic.
Right. And for the people here, and I think everyone here is pretty sophisticated in healthcare, but I get criticized for not defining things. DSRIP is Delivery System Reform Incentive Payment, and it's part of the pool, one of the pools used for Medicaid reimbursement, just so you'll know. And that's, when we say DSRIP, that's what we're talking about. Christian, we talked about 5 million uninsured. We've talked about Medicaid 1.5. So we still have quite a few people uninsured. When we look at the insurance marketplace and the exchange that we have, especially in Texas, and again, not getting into politics, but it's fact, the enrollment period's been shortened, the advertising and marketing related to the enrollment has been cut, and the Navigator budgets have been just completely cut, completely. I think there are only 2 navigators in the organizations in the entire state of Texas. As you use your insurance experience, and as you look at your crystal ball, what happens if the exchanges deteriorate or, worst case scenario, go away?
I think in terms of the exchange, what might change is the way it's funded, whether the federal government continues, depending upon the administration at the time, whether the federal government continues to fund and or give subsidies to the to folks who want to sign up on the exchange might change. But I think that in terms of what the exchange actually is, if we think about it, it is a website. It's a platform by which any single one of us could, if we so chose, go on and choose a health plan that would quote unquote meet our needs. That's really hard for most people. It is not easy to make these choices. The federal government has done a fine job or a better job of helping seniors make choices about Medicare plans by allowing the prescription drug coverage and putting these comparison tools in Walgreens and CVS and that kind of thing. As far as the exchange platform, I think it still needs some work. So taking the navigators away, some plans, even though commissions are allowed, just simply don't pay commissions, and yet the agents are still helping people enroll in exchange plans even without being paid commissions, because either it's a long-term play for the agent or it's a long-term client, or perhaps they have their life insurance through them or something like that. But I think that the platform is not going to go away. It's still going to be there. I think that the way in which it is funded will change in terms of the subsidies. And quite frankly, Texas is, I've worked in states that have federally funded exchanges like Texas, and also who choose when and if and on any particular day whether they want to be involved in the regulations thereof. And I've worked in states that are a hybrid, and then states that are state-funded exchanges. So it's different across the country. But here in Texas, with our federally funded exchange, unless we do something like expand Medicaid, which is incredibly necessary, the platform of the exchange will still be there. But I think that our uninsured citizens of the state are just going to go up.
Right. I'm going to certainly allow time for questions because the best questions come from the audience. But, you hit on something. The state of Texas is very blessed because we have good employment. But I think sometimes people look at the unemployment and forget that many of the people that are employed are the working poor, and they don't qualify for a lot of the programs that we talked about, and that continues to increase. So with that in mind, I was in Washington 3 days this week. There's still a lot of talk about Medicaid block grants. And so I want to just ask kind of a lightning rod question before we turn it over to the audience. What are your thoughts on Medicaid block grants, Senator?
I think it's an excuse not to move forward. We've been holding our breath, hoping that we get a pony for Christmas for like 6 years, and it keeps not coming. So we keep saying we're going to get block grants. I don't think it's coming, number one. Number two, there's downsides to block grants. Block grants are prepackaged. Currently, the way the Medicaid system is administered, we receive funding based on the number of patients. A block grant, there's your money. If your patient load goes up, like in a state with explosive population growth like Texas, we're in trouble. There are other downsides to block grants, but they're not the solution to our problems that everyone thinks it is. The third thing I would say about them is they're unpatriotic. Medicaid is a program that has worked for this nation for over 4 decades. A lot of people have put their careers into making this something that serves people well, and it has done a great job. It's highly imperfect. We need to do a lot of work on it, and with 1115 waivers, by the way, I can't believe what a good job you did with that. We'll never get another one that good again. No, really. Texas would have been in really, really bad trouble had you not pulled that off. Because Texas was not politically ready to move forward, and we were not ready at all, and we've been given some breathing room, and now time is up. So we really got to move forward. The block grant, to get back to the unpatriotic aspect of it, and a bit of arrogance too. We're really going to figure this out by ourselves? Come on. But the beauty of this is, though, through the future 1115 waivers, is we do have a unique population. We do have unique expertise. There is a value to laboratories of democracy and commercial and market experiments for all that. So we get ways that we can implement Medicaid in a way that works for us. We learn from the mistakes and the successes of the 32, 33 states that have gone before us, and stop wishing for a block grant where we can reinvent the wheel. There's some good things in place right now. Let's build on them, not pretend that we can figure it out all by ourselves.
Great. Charles, I wouldn't have asked you this question 3 years ago out of respect to your position. But what do you think of block grants?
Well, I would say at its simplest form, a block grant would ultimately, I would say, destroy the state from this perspective. We are a growing state, very robust economy, and a block grant would be just that. The federal government gives you a sum of funds, and that's it. And so without some type of per capita growth or something like that to move along with it, the only thing you're going to be able to do is to continue to cut and reduce cost and benefits and packages and those type of things. And a lot of people don't think it this way, but we're a society, and a society is a system, and there's interconnectedness. And I think that's where oftentimes we fall short, whether it's with our public policy, healthcare policy, whatever, is that we try and isolate things through silos. And anytime you have a silo, you have gaps, even when you put them together. So a block grant would either force us to create a system that was so draconian that it didn't provide for the level of care and quality for the individuals who would be in it, which would then have other cost to those who are not in it on the system that would drive up cost, whether that's in criminal justice, whether that is in child welfare costs, homelessness, and the things that come along with that. And so you just turn it into another form of needing government assistance elsewhere. And that's what people really need to look at, is not just saying, give me control so I can design, but if you design within a box and you don't truly try and create something that is holistic, that works, and I believe that welfare should be transitory, transitional. You help someone, you move them up to where they can then become self-sufficient, and they are a productive member of society where they can then help others because they're paying taxes and so forth.
Right. Christian, I know you've designed a lot of different plans, and you're an insurance expert. Your thoughts on block grants?
I concur.
Okay.
Is that an answer?
Sure. They made some great points.
They did. They've made some great points on them, and quite frankly, I disagree with them as a political tool, quite frankly, used to try to control that which is going on. And I will take credit for some of your good work, because we did pay a lot in liquidated damages when I was, had that Medicaid.
Great.
So.
Let's go to a first question from the audience. David Tesmer.
So first of all, thank you very much for all your comments. I will ditto on the block grants. That's just code for funding caps for the federal government, just to say that they're not going to get any more money. So thank you. So Senator, I know that we've talked about this a lot. With the majority of individuals getting their health insurance from employer-sponsored plans, what can we do to work with you to help you? And what you talked about earlier is getting the business community involved, because there's no such thing as free health care. It's all passed along. So when we get hammered as healthcare folks, as providers, that our costs are too high, we're having to pass along a lot of those costs because we're covering for a large proportion of individuals who come into our facilities who have no means to pay, or their copay is too high. So what can we do to work with you to get the business community involved and say there's no such thing as free health care, and how can we work?
I really think we have to reach out directly. And actually, Steve, do you want to relay to the audience the story about your letter? You wrote a letter to some CEOs. Or not?
Not this past session, the session before. Real tribute to the Chambers of Commerce. They really all came out and supported Medicaid expansion. So I had a template letter, and I contacted a lot of Fortune 500 CEOs in the Dallas-Fort Worth area, and I said, will you sign this letter? And they said, absolutely not, but we'll stand behind the Chamber of Commerce.
Right, and so if that's our beginning point, we need to revisit all those people, all of them, and you should contact businesses in the area. I think most of them by now do understand the economics of it. I'd be happy to work with people and develop talking points. I already have quite a few of them outside of this piece of paper. No, really, this is way too important to leave behind, and the business community in North Texas, I think, is actually doing a better job than anywhere else in the state at recognizing at this point, after pursuing pure, a largely economic agenda for a couple of decades, that we've neglected some of the social areas, and that those two things are related. That the neglect of social issues is going to create economic problems. So we need to talk to them in terms of what are the costs to your business when people don't show up to work because they have to go take care of a sick kid or because they're sick themselves. What are the costs to you in terms of the health insurance premiums that that you're paying? And why are people complaining about care? Bren, because they go into the emergency room and they can't get care because there's a line of indigent people ahead of them because it's the only place they can get care. We're not just talking about dollars, we're talking about access and quality of care. Failure to fund mental health, you have to staff mental health incidences at a much higher ratio than you do everyone else. If we're not taking care of people before they get to the hospital, that compromises the quality of care of everybody who's on an employer-sponsored or any other marketplace or private market plan. So we really need to make the economic case to businesses, and I think they're coming around to the moral case. I really do, and I think North Texas may be exactly the right place to push this forward. Because the last thing that I want to emphasize on this, and I'm using your question as a springboard to that, I think there are a great many conservatives who want to move forward with serious healthcare reform, possibly even the M word, and they're afraid to, and they're not illogically afraid to, they're quite logically afraid to. There's tremendous political pressure on them. And I've had private conversations with people. They're frightened to say the word Medicaid.
And they're certainly not going to put their name on a piece of paper that says it.
But they won't because they will be
They're
politically,
afraid.
in the past, they've been politically punished for it, either in a primary or by leadership. And when we talk about the last election and what happened with education, if they perceive that that's going to happen with healthcare, or if in fact it does happen with healthcare, it's now a completely different discussion in, say, a Republican primary. It's time for Texas to move forward. I am so happy to work with any Republican who wants to expand Medicaid. They've got to be afraid of not doing it. And those conversations can take place in the workplace. So contact CEOs, contact anybody you know at any corporation, get them behind us on this, and let's start communicating with the public that this is not an economically irresponsible thing to do. It's the only economically responsible thing to do.
Thanks.
Having come from the payer side, though, and I think that Charles, you would probably agree with this, we've got to have providers who are willing to contract for and treat Medicaid patients. And part of the problem is that there are, unfortunately, a lot of providers who simply do not want Medicaid patients because the Medicaid patient, the Medicaid fee schedule isn't high enough. Or, well, if we have to treat them anyway, we know we're going to get 95% of that. So we, I think, really need to start thinking about it in terms of ourselves. Let's look in the mirror first, too, right? And determine whether we want that, whether we would be willing to accept Medicaid contracts, even if they didn't come along with a great commercial deal.
Let me just very quickly, David, to follow up your question, is that you will have business people that will say, if we were to raise the minimum wage to $15, is that everything goes up because businesses are going to pass along the cost. And so that means, the burger or whatever it is, the steak you're eating, it's going to go through because they're going to continue to maintain and do best they can to maintain their profit margin. Yet in the healthcare arena, for some reason, we try to divorce that same rationale or logic from this. And you have a number of people who are on Medicaid, almost 4.5 million in Texas, a Medicaid chip. And then you have another 5 million people and so we understand that through Medicaid rolls, you continue to drive down costs and that flows downhill. And you deal with providers that are not willing to sign up as a result of that and some of the other aspects of Medicaid enrollment and the red tape and so forth. But then the other part of this is, for the uninsured, is that the EMTALA statutes require them to be treated.
Right.
And when you do treat it, there's a cost associated with that. And what the hospitals and providers do is that cost gets passed on to those of us who have health care and who have insurance policies on the private side. And that's whether you're a state employee with self-funded insurance or anything else. But we somehow divorce that rationale and that natural tendency and try and isolate this. And we have to get people back to the table to see this as the system it is, because until you begin to do that, you're not going to have the overall healthcare costs. And we talk about how the rising healthcare cost chokes businesses. It's going to continue as long as we don't address the costs associated with Medicaid, and if we don't address those that are uninsured that still seek health care.
Or even the bronze plan members, those members oftentimes have to, if you're in a network, a provider network with a plan, and they want to negotiate rates, they force you to accept all of them. Bronze plan members are signing up for essentially catastrophic coverage, but guess what? Bronze plan members still have babies. They still have to go to the ER every so often. They still do these kinds of things. But if they're bronze plan members, they are likely highly subsidized. So the likelihood of the hospitals or the treating providers getting paid that portion of their portion, because these bronze plans have such high deductibles, is very low.
Right. We're going to go to another question. Great question, David. Yes, I think we have a question here, and the microphone is en route.
I have a question for the senator. Can you point to one of the 30 or 32 states that have done this right as far as expanding Medicaid, and tell us who we should?
I don't think there's a single state that we should pick and say we're going to emulate them. What I can tell you is 32 states have expanded Medicaid, and we've got 32 of them have had good results from it. And there are people who have greater expertise than I do in that. There are different models. Mississippi is experimenting with something right now. They haven't done it yet. Yes, Mississippi's got a little edge on us. And they're doing it with no... Sorry, Mississippi.
That's so embarrassing.
But really, they have fewer resources than we do, and they're moving forward. They're looking at a model where there is no state contribution whatsoever. And I've looked and talked with experts about how we could expand Medicaid without a dollar from the state going into it. That could be a model if that's politically palatable. There's work requirements. They don't work very well, but if that's politically palatable, we can have something that resembles that gives people some ease so they can go back to their voters. So I really think we need to look at all the different states. What have they done? What aspects of their plans correspond to our experiences here in Texas, and lift those up rather than pick an individual model. There may be people in the room that have more knowledge about specific state health plans to say, yeah, that's the one. But ultimately, it comes down to political viability as well. Even if I could say Ohio has the one that's going to work best for us, I got to sell it in the Senate and in the legislature and to leadership. And that may be different than the Ohio plan.
And they don't have the same population.
It's a fair question and an unsatisfying answer, but it's the real answer, which is we're going to have to draw on the whole range of experiences to come up with our own.
We're going to try to do another question. Questions? It's kind of hard to see if hands go up.
I think this is more for Charles and for Senator. I believe that there will be a lot more business folks, and there have been some in the past, who are CEOs of large companies that are not healthcare companies, who have signed on and said they would support Medicaid expansion. I think also that the voters in North Texas have made a lot of changes lately to who represents them. I believe you mentioned that, Christian. There's a lot of them. That means we have a lot of young delegates and representatives of this organization, or of this part of Texas, not necessarily young in age, but young in experience in the legislature. How can people who are of like mind in the business community and the healthcare industry and others help you to be more influential in the legislative sessions to come on this particular topic?
I would say the first thing is, and it's not like we're going to draft talking points and get them sent out to everybody, although that would be pretty good. But I would say the first thing is that people have to understand how to have the conversation in like an elevator speech. Very short, concise. And because there's so much misinformation there, things that have been repeated time and time again that now we take for granted. And so part of that is to educate the business community in what having a healthy Medicaid system looks like, what the benefits are to them. They're going to be hiring these individuals who may not be taking great care of themselves from a health care perspective, and it's going to drive up their costs if they're self-insured. And so you're going to hire someone who may come into your organization that had they had the right preventative care up front would drive down your cost. And so people have to understand how it's going to impact them. And I think there are several ways that you can do that, and I saw the clock, I'm running out of time, so I'll be quicker. I'd say first, make sure that they understand how it impacts them. Be ready to address a lot of the misinformation. And then most importantly, let them know that failure to act is going to be catastrophic for our state. And I think the businesses that are in this state are here because they love the state and they love the environment that we have that's pro-business, pro-growth, and we want to maintain that. And if we have a subculture or a class of people who don't have the right health care, it impacts them later on. And we're having that same conversation from the education side. If you don't train your workforce and invest in them, then you're going to have problems hiring for your jobs later on.
Excuse me, Senator.
Just let me touch one real quickly. I think we're going to have to go outside of North Texas. A lot of the misperceptions lie in rural areas that will benefit greatly from Medicaid expansion, where hospitals are closing. They need to understand that this is in the interest, that it's in their interest, in the interest of the entire state. They need to know that the people represent them support this movement, or they should leave. It should become an electoral issue, and I don't wish anybody losing their seat. I just want them to support Medicaid expansion and health care for Texans and business growth as a result of all of that. So talk to people outside, talk to medical providers, hospitals, insurance companies, whoever you want that represent these rural regions, and get people talking and thinking about this issue.
You've been a great audience. We're out of time, but let's give these panelists a round of applause.